ACPS Reopening Community Chat. Thank you for making time to join us this afternoon to lift up and consider some of the concerns and questions that are bubbling up in our parent communities. In order to hear the entire chat in English, please click on the globe interpretation button found at the bottom of the screen on your computer or phone and select English. Please make sure that the mute speaker option is not clicked. Hola, mi nombre es Krishna Leiva y soy la encargada del programa de participación de familias y comunidad para las escuelas públicas de la ciudad de Alexandria, mejor conocido como FACE. Hoy tengo el honor de servir como comoderadora con alguien que realmente admiro por su labor y dedicación a nuestras familias. Sin más ni menos, le presento a la señora Adriana Gómez.
Gracias, Krishna. El honor es mío también. Es un honor estar aquí con ustedes. Yo soy la directora ejecutiva de Casa Chirilagua y esta reunión es muy importante donde vamos a escuchar sus preguntas. Gracias por tomar su tiempo de estar aquí. Ya sé que ustedes como papás tienen mucho que hacer, pero esta reunión es muy importante para ustedes y se ha hecho para ustedes, para que ustedes puedan hacer sus preguntas y los líderes de ACPS puedan responder a esas preguntas. Quiero asegurar que estoy leyendo todo. Se colectó preguntas a través de una encuesta y vamos a tomar el tiempo de, ustedes van a tener la oportunidad de enviar sus preguntas, asistir en este chat y decirnos sobre los problemas que les preocupan y así trabajar con ACPS para encontrar posibles soluciones para de la reapertura de escuelas que reflejen los problemas que las familias pueden enfrentar en el otoño. Así que esas preguntas son sobre qué va a pasar en septiembre con las escuelas. Voy a plantear la mayor cantidad posible de preguntas en los próximos 60 minutos para proporcionarlos la mayor cantidad de respuestas posibles sobre la reapertura de las escuelas. Primero, escucharemos algunas palabras del superintendente, el Dr. Hutchings.
Buenas tardes, bienvenidos. It's really great to be here. I am so excited about today's discussion. For one, each of you, I have to say that your voice is power, and we want to hear from our Spanish-speaking community, especially. And this is going to be, I hope, a very deep discussion around, how we're planning to reopen our schools. And we hope that you all will get your questions answered today. And I just want to welcome you to Alexandria City Public Schools. And I also just want to thank our moderators today for being able to facilitate this discussion, as well as all of our panelists. So I'm looking forward to having a great discussion.
Muchas gracias, Dr. Hutchings, y al personal de ACPS que se ha unido hoy aquí con nosotros. Les quiero presentar a los líderes de ACPS que están aquí con nosotros. Ellos son el Dr. Stephen Wilkins, que es el jefe de personal, el Dr. Terry Mozingo, jefe de enseñanza, aprendizaje y liderazgo, el Dr. Gerald Mann, el director ejecutivo de apoyo educativo, la doctora Elizabeth Hoover, directora de tecnología, la doctora Julie Crawford, jefe de servicios estudiantiles e igualdad, la doctora Bethany Nickerson, directora ejecutiva de servicios para estudiantes de inglés, Terry Werner, director ejecutivo de instrucción especializada, Doctora Alicia Hart, directora ejecutiva interno de instalaciones y operaciones. Erika Gulick, directora de programas de capital, planificación y diseño. Muchas gracias a todos que están aquí. Gracias por tomar de su tiempo. Según las preguntas que se colectaron a través de la encuesta y antes de esta reunión hoy, me gustaría intentar dedicar bloques de tiempo iguales para poder entrar en profundo en diferentes temas. Los temas para el chat de hoy serán salud y seguridad, la entrega de las instrucciones y currículo, cuidado de niños, necesidades extraescolares, logística y otras preguntas. Por favor, no dude en hacer sus preguntas. Queremos escuchar de usted. Queremos escuchar preguntas adicionales sobre estos temas en el cuadro de preguntas y respuestas. Krishna vigilará el cuadro de preguntas y va a asegurar en dar sus preguntas a los panelistas según el tiempo que tengamos. Cualquier pregunta que no se responde durante este chat en vivo se publicará en la sección de preguntas y respuestas más comunes después de la serie de chats de la comunidad haya concluido. Así que su pregunta se va a escuchar, aunque no tengamos tiempo hoy, vamos a responder su pregunta.
Antes de continuar, quiero también introducir a la doctora Marcia Jackson y también al señor Darren Sampson. Ambos trabajan como directores ejecutivos de la Oficina de Apoyo a los Estudiantes. Antes de entrar de lleno a todas las preguntas, queremos agradecer a todos los padres de familia que completaron la encuesta de reapertura. Tuvimos más de 11,800 respuestas y en esta encuesta nos mostró que la salud física y la seguridad de los estudiantes era un factor principal en todas las decisiones para las familias. O sea, en eso ellos basaron la mayoría de sus respuestas. Es por eso que me gustaría compartir con ustedes los resultados. Según la encuesta, el 40% de nuestros padres que completaron las respuestas online, ellos prefieren un modelo completamente virtual. ¿Qué significa eso? El modelo virtual se refiere cuando usted está en la casa y por medio de una computadora va a recibir le van a impartir todas las clases y no va a ir a ningún edificio de escuela. Mientras que el 60% prefirió un modelo híbrido. El modelo híbrido se refería a un par de días en el edificio, en persona, y otros días en la computadora. ¿Ok? So, ambos, o sea, mixto. Básicamente, quiero recalcar que ACPS todavía no ha determinado qué combinación de modelos vamos a utilizar en el otoño cuando abramos. Pero eso nos alegra por eso nos alegran que ustedes estén aquí hoy, porque podemos escucharlos y también podemos conocer más acerca de las preocupaciones que las familias pueden tener a mayor profundidad. Así que ahora le voy a dejar a Adriana, que va a comenzar con las preguntas que nos hicieron ustedes anteriormente.
Gracias, Krishna. Comencemos con nuestro primer tema, que es salud y seguridad. Por favor, siéntense libre de poner sus preguntas adicionales en el cuadro de preguntas y respuestas que pueden ver en el Facebook Live o en el Zoom. Entonces, la primera pregunta es, si se toma la decisión de reabrir los edificios escolares, ACPS requerirá que los estudiantes usen o no usen equipo de protección personal, es decir, máscaras, guantes, protección personal. Todavía se nos pedirá comprar desinfectante, toallas de Clorox y jabón para la aula como un año normal. Esto es costoso para muchos, es decir, los padres van a tener que comprar estos artículos porque es un costo. Eso es la primera pregunta.
Sí, so Adriana, eso es algo, yo no sé si tú has
You know,
ido
I think that is a really good question. And it's a concern that many of our families are having at this time. And I think that, one, if we're requiring face coverings in our schools, you know, we are going to be providing those face coverings as well, because we understand some of our families may not be able to provide face coverings for their students. We are also having our hand washing stations and hand sanitizer stations throughout our schools so that students are, if we are back in person and students are in our buildings and staff are in our buildings, then they're able to wash their hands and for us to have the appropriate materials for them. Dr. Hart, who is our acting executive director of facilities and operations, she can elaborate a little more on just like the planning behind ensuring we have the appropriate stock and soap dispensers and things of that nature.
Dr. Hutchings, and good afternoon, everyone. So as Dr. Hutchings mentioned earlier, our plan and all of the plans that we have been working towards does include ACPS providing the necessary PPE for our staff and families if we return to an in-person model in the fall. In terms of quantities and numbers, that information is still being worked out, but I just want to reassure our families that we do not intend to provide guidance that would make it necessary for our family members to be the one that takes on that burden financially. And so I want to briefly address the cleaning aspect as well and the hand sanitizer. As Dr. Hutchings mentioned, we have hand sanitizer stations that will be available at all of our schools that will be provided by ACPS. So again, that would not be an expectation for our families to provide hand sanitizer or other materials with their students as they come to our facilities.
Ok. Muy bien. La segunda pregunta. Si ACPS decide abrir edificios escolares, ¿cómo podrá mantener los 6 pies de distancia entre estudiantes en autobuses escolares, en las aulas, en las cafeterías, en los parques infantiles?
Esta es muy buena pregunta. Dr. Hart, ¿usted pudiese contestar esa pregunta o alguien del panel?
Yes, and I will also ask Ms. Erica Gulick to join in on the answer. We are establishing plans that will allow the capacity of 6-foot social distancing for all of our students and staff members that will re-enter the building. Specifics regarding that, I will ask Ms. Erica Gulick to share some of the guidance and the planning that we've done thus far regarding our capacity planning.
Thank you, Dr. Hart, and good afternoon. We are currently evaluating all of our spaces to see how many students and staff we can safely accommodate within our existing spaces. In addition, it will take a lot of communication to staff and families regarding the expectations for students to maintain a safe distance from each other. Thank you.
Gracias. Pregunta número 3. Yo comparto un apartamento con otra familia. Tengo 2 hijos en la escuela primaria y ellos y las personas que comparten el apartamento tienen hijos en la escuela intermedia y secundaria. Si uno de ellos se enferma, ¿cerrarían las 3 escuelas?
Eso es algo que nos preguntan muy seguido los padres, porque algunos de ellos comparten apartamentos o residencias. Me gustaría que una persona del panel nos pudiese contestar esa pregunta. acerca de esto.
I'll start with that, and if Dr. Jackson, she can elaborate if needed. So one, we do have what we call contact tracing. And contact tracing is when a person, either has symptoms or has been diagnosed with COVID-19 by a health professional, then there is contact tracing that occurs where our health department, and we work closely with our health department, begin to determine who are potential people that may have been exposed. And it really depends on, on each particular case. One thing that the research is showing right now is if we are following the CDC guidelines, meaning we are practicing social distancing, we are wearing face coverings, we are making sure we're washing our hands and using, different safety precautions, that we're limiting the possibility of being infected. So those are the types of questions that our health professionals would ask to determine what our next steps are. And what we do is we just follow the guidance of the health department, and we do not, have just a blanket process because every situation is so different. But one thing that we can say is if our buildings are going to open this fall, that we will be following the CDC guidelines, which means we will be requiring face coverings. We will ensure that we're 6 feet apart. We will ensure that we're having hand washing stations and encouraging our students to practice some of these safety precautions during the school day. Dr. Jackson, I don't know if there's anything you want to add to that.
The only additional thing I would add is that we have cleaning protocols in place so that if there were any type of exposure, we would definitely look to isolate that area and do that deep cleaning process that we already have in place to ensure that we would take care of anything that's been in that space that could potentially spread the virus.
Muchas gracias por contestar. Yo sé que muchos padres deben estar haciéndose muchas más preguntas. Una de ellas, por ejemplo, es si un estudiante o maestro se enferma con COVID, ¿toda la clase tendrá que pasar por cuarentena durante 14 días? ¿Qué pasa si el profesor de arte se siente enfermo y se tiene que quedar en casa? ¿Qué clase, cada clase que vio a ese maestro tendrá que quedarse en casa en cuarentena también? ¿Y qué pasa con aquellos maestros que, por ejemplo, educación física, del DPI o de música, que muchas veces son los únicos maestros? ¿Quién, Dr. Mozingo, nos podría ayudar o alguno de los panelistas a contestar esta pregunta?
Again, we would work with the Alexandria Health Department, and they would really be the experts who would help us identify what steps we need to take. We will have protocols in place for all of our staff in terms of if we have reported cases, and that contact tracing that Dr. Hutchings mentioned is very important in determining to what extent we need to we've had impact in a classroom or throughout the entire school. So we would work with the Alexandria Health Department to determine how we need to move forward with a case like that.
So básicamente para reiterar lo que dicen aquí es los padres deben estar seguros que nosotros como división estamos comprometidos a la seguridad de sus niños y nosotros estamos tomando las medidas con los expertos necesarios para estar seguros que los niños van a estar bien. Ahora queremos contestar algunas de las preguntas que nos han hecho en el Zoom y en vivo en Facebook. So, una de las preguntas que tenemos aquí es, ¿existe ya alguna idea cómo sería el transporte para los alumnos o se preferiría que los padres transportaran a los hijos? Esa pregunta la podría hacer, ¿la podría contestar Dr. Hart o alguna otra persona encargada?
Absolutely. So we are looking at a number of potential transportation models to include not only our traditional transport in terms of busing of students to school, but also looking at options regarding walk zones and parent drop-off. In regards to bus transportation, in order to properly social distance, we are having to do one student per bench and alternating each row. That means that our normal capacity of students that we can typically transport on a bus would be significantly reduced in order to maintain the proper social distance and help with any health and safety concerns regarding COVID. We would work with our parents and understand through not only survey results, but also just individual needs, what the necessary requirements would be, or options would be for transportation, understanding that we will not have the ability to transport the same number of students as we would in a normal school situation. So all of that to say that there are multiple options right now that could be on the table regarding how we get children to school, one of those being a reduced capacity transportation model using our buses.
Gracias, Dr. Hart. Uno de los padres escribió en el chat, ¿el horario escolar sería el mismo que antes para las clases en persona si se reabrieran los edificios?
Dr. Mann, do you want to talk a little bit about the schedules?
Sure. Yes, we are currently looking at a multitude of options for our schedules. I think the question was around start times. We're looking at the start times as far as how long the day would be, the amount of screen time for our students. And those are all of our considerations. Right now, we're looking at a schedule for a hybrid, where students would have Monday would be a planning day for teachers, and the students would take part in asynchronous learning, meaning that they would be working independently on a project or an assignment that a teacher had for them. But then on Tuesday and Wednesday, we would have what we're calling Group A. And so they would have 2 consecutive days of school. The Group B students would be at home doing asynchronous learning. And then on Thursday and Friday, Group B would be in school Thursday and Friday, 2 consecutive days, and Group A would be at home. And then for the virtual schedule that we're exploring, all students would still have Monday as a planning day, but then Tuesday through Friday, everyone would have sets of classes. We are currently trying to work through the feasibility of which one would work. We're also developing expectations for students, teachers, and all staff actually. And then also what does feedback look like in either option? And then again, as we are trying to make sure that we take lessons learned from the spring on defining what synchronous learning looks like, meaning live instruction, and then also asynchronous, what does that look like at home as we try to support our students, but also make sure that we have resources available for our families to support their students as they learn at home in either model.
Thank you, Dr. Mann. So, básicamente sería los lunes, todo el mundo va a estar fuera de la escuela en uno de los planes que ellos están analizando. Martes, ese día ellos van a estar trabajando de la casa. Se le va a dar trabajo con módulos en la computadora. El martes, un grupo, por ejemplo, el grupo A, va a ir a las clases presenciales, o sea, en persona. Otro grupo va a quedarse en la casa. El miércoles va el grupo B y así sucesivamente. Toda esta información se la vamos a hacer más disponible en nuestra página. porque sé que es un poquito complicado, ¿verdad? A, B y todo eso, pero si tienen alguna pregunta nos pueden llamar también, pero vamos a ponerlo todo en nuestra página. Y ahora vamos a pasar a nuestro tema número 2 con Adriana, que va a empezar a hacer otras preguntas que ya los padres nos han hecho.
Gracias, Krishna. Ahora vamos a hablar del segundo tema, que es la entrega de instrucción, es decir, cómo se va a entregar la información a los estudiantes, ¿verdad? Cómo se van a instruir los estudiantes. Por favor, acuerden que pueden poner su pregunta en el chat, en la cajita que dice Q y A. Ahí puede poner su pregunta, así que vamos a empezar con este tema. La pregunta en este tema es, ¿está ACPS considerando la opción de iniciar todo virtual y luego la transición a híbrido más tarde, como en noviembre o diciembre, según los casos de COVID-19? Tengo mucho miedo por mi hijo.
Sabemos que existe bastante ansiedad entre los padres, lo escuchamos a diario, y por parte de ellos y también por parte de los estudiantes. Le podemos asegurar igual que las escuelas están comprometidas con el bienestar de nuestros estudiantes y familias, pero voy a pedirle a uno de mis colegas que me dé más información y le explique a los padres cómo nos estamos preparando.
And this is preparing for, can you repeat that part again, please?
Sure. So we know that some of the parents might be a little anxious about sending their kids home. So the question was, is ACPS considering the option or to start virtual first and then transitioning later to in-person? Since this parent says that is very afraid to send their child to school right now.
So one thing that we are looking at is we're determining what is the feasibility of reopening, like what options are feasible, meaning whether 100% virtual, meaning 100% online, or the hybrid approach where kids are in school some days and they're at home some days. We're determining what's feasible out of those two possibilities, meaning are we capable of getting kids to and from school safely and healthy? Are we able to have kids, if they're going to be in school, are we going to have the staffing available to be able to teach them, in school? Are we going to have the appropriate face coverings and soap dispensers and hand sanitizers? And are we going to be able to actually do all those things if some of our kids and our staff members are in school? So what we're analyzing right now is, are these things feasible? Next Friday, we will be able to share out with our community about what is feasible for reopening, and then we're going to provide the full plan, meaning all of the components of the plan, from what's feasible to how we're going to implement to what are going to be some of the supports that we're going to need to provide our families. We will be able to share that on August the 7th. And then we will be submitting the official document and plan to the Virginia Department of Education on August the 14th.
So básicamente lo que está diciendo nuestro superintendente es que antes de tomar una decisión se van a analizar múltiples escenarios. So, básicamente se va a analizar cómo llevamos los niños a la escuela, cómo los niños van a estar en la escuela, qué tenemos, qué no tenemos, qué necesitamos y si es algo que podemos hacer para la semana que viene, el viernes, poder decirle a los padres, esto es lo que vamos a hacer y esto es cómo lo vamos a hacer, que eso es lo más importante, ¿verdad? Muchas gracias, Dr. Hutchings.
La siguiente pregunta. Desde que la escuela cerró en marzo, mi hija, que estaba tomando clases de inglés como segundo idioma y estaba muy avanzada, ya no habla inglés y siento que perdió todo el conocimiento que adquirió el año pasado. Si ACPS decide por el modelo virtual, ¿qué recursos habrán disponibles para ayudarle como estudiante EL, English Language, ya que no habló inglés o no habla inglés?
Yo sé que ACPS cuenta con instructores especializados de inglés como segundo idioma que trabajan con nuestros estudiantes. Y yo sé que la doctora Nickerson puede dar más información acerca de estos programas que nosotros tenemos. Dr. Nickerson.
Thank you. First, I'd like to share that I'm glad to hear that your daughter is taking English learner classes and has progressed well to an advanced level. That's fantastic. In terms of support for her as an L student, in the spring, our L teachers at each school had specific students by grade level who they would reach out to each week to ensure the students were understanding their classroom work and to help if they were having any difficulties. The L teachers also worked closely with the classroom teachers to ensure the lessons were accessible for our English learner students. In the fall, we will continue with those practices, and additionally, we will integrate into the schedule a dedicated time for English language development class with an English learner teacher, so direct instruction in English. With regard to resources and support in Spanish for parents, ACBS develops its materials, its information and website in English, and then translates all of the information into Spanish as well as into Arabic and Amharic. The ACPS website is a great source for information. Additionally, we have the language line service that our teachers can use to talk with parents in Spanish and in other languages. And we have bilingual parent liaisons at the schools that are a helpful resource. And we have a bilingual information line in Spanish through our FACE Center. And I'll just take a moment to share that number. It's 571-775-9719.
Thank you, Dr. Nickerson.
La siguiente pregunta. No conozco el sistema escolar y no hablo inglés. Si ACPS es todo virtual, ¿qué recursos tienen para que los padres ayuden a sus hijos con las tareas escolares? ¿Estará en español? ¿Solo estará en la computadora como correo electrónico?
Dr. Musingo, ¿nos puedes ayudar con esta pregunta o Dr. Hoover?
Yes, I can. Yes, good evening, everyone. And so I'd like to say that we will be providing support for this area. One of the things that, as Dr. Nickerson just mentioned, we also translate materials in different languages. We will also provide professional learning, professional support, and resources for families.
Thank you.
I think that was a question, right? I want to make sure I answered the question. Okay, good.
¿Querías agregar más, Krishna?
No,
Okay.
no, podemos ir a la próxima.
Ok. La siguiente pregunta es, ¿qué servicios se ofrecerán a los niños con deficiencia de atención o hiperactividad u otras necesidades especiales? ¿Es posible la tutoría individual?
Esta es una pregunta que muchos padres también nos hacen y me gustaría saber si Terry Warner nos pudiese ayudar acerca de esta con la respuesta.
Thank you. we have services for students with all kinds of disabilities, and we have teachers and case managers who will work with families individually to address the learning needs that their students have. We work with students with attention deficit disorder, and we will also have opportunities for teachers to work with students in small groups and in one-on-one situations. So there will be a variety of options available for students with disabilities to meet their unique learning needs.
Thank you. Muchas gracias. So, también hay otra pregunta que dice, mi hija es estudiante de ACPS, pero va a una escuela privada en DC. Si Alexandria no abre, ¿eso significa que no puede ir a una escuela privada? Quiero que ella regrese a la escuela.
So that really is a residency question. And if you are not a resident in the District of Columbia, you're not able to go to DC public schools unless you're paying, some form of tuition to go to that school. So typically, you have to live in the city where your schools are located in order to attend those schools for free of charge. However, all of our neighboring jurisdictions, if you don't live in those cities, you can pay to go to those schools.
Muchas gracias. También tenemos otra pregunta y esta es para Dr. Hoover. ¿Habrán herramientas o formas de cómo los padres pueden recibir ayuda para ayudar a sus niños en la casa, especialmente con aquellos que la instrucción por medio de computadora es un poco difícil, y cómo ajustarlos a ellos a esta vida normal, lo que es nuevo normal?
Yes, so this, in August, we will be providing all students in 2nd through 12th grade Chromebooks, and all students in pre-K, kindergarten, and 1st grade tablets to help them access the curriculum. We are working on how we will distribute those devices to the pre-K, K, 1st and 2nd and 3rd grade students, as well as any new student to the division. We are also working on developing more videos in Spanish, Amharic, and Arabic that will be available on our website to help parents understand the technology and to better help their students at home. And then we're also planning on doing some webinars like this to walk parents through the process, and for our students who may have forgotten how to log into their Chromebook or their passwords over the summer. The need for internet access, if you identified the need for internet access, we will be providing that as well.
Muchas gracias, Dr. Hoover. Mr. Sampson, una de las preguntas es cómo los padres pueden ayudar a sus hijos o qué tipo de apoyos tenemos en ACPS para poder lidiar con estudiantes que quizás están un poquito desafiantes y no quieren estar en la computadora o no quieren estudiar desde la casa. ¿Hay apoyos para estudiantes?
Sure, I think there's a couple of things we can talk through there. So in terms of the students, one thing that's become really clear and is a priority for ACPS is that we want to make sure that we are connecting with students and providing them with opportunities to build relationships with their teachers, build relationships with their peers, and support that connection to their curriculum and the activities that they're doing within their classes. And that's really something that we want to do whether or not they're in a virtual model or in a hybrid model. I think we're really looking at in either model, how are we providing students with those opportunities to connect with their teachers and their peers, and then also to program in some social, emotional, and academic learning, so that we're really teaching them skills that will help support them if they're still at home or if they're coming into school, only a few days a week. So we are absolutely looking at that. In terms of supports in schools for parents and students, their school counselors, their school psychologists, their school social workers, their school nurses will still be available to them during the school year. And any parent at any point can please feel comfortable to reach out to their child's school counselor, school psychologist, school social worker, or school nurse. We have, particularly, we have several bilingual Spanish-speaking student support team members that are happy to take those questions and concerns from parents and provide that really individualized discussion about what are your child's strengths, what are some of the challenges that you might be seeing as a parent, and then let's strategize some different tools or techniques that you can try at home to help really re-engage them in that process. We are live and here and ready virtually or face-to-face to really help families with whatever those challenges may be.
Ya saben, padres y madres y familias, no están solos, estamos aquí, somos un equipo y estamos trabajando juntos, así que siéntanse en la libertad de llamarnos, llamar a su escuela y pedir ayuda. Nosotros estamos aquí para ayudarles. Ahora vamos al tercer tópico, tema. Se les voy a dejar a Diana para que ella continúe acerca de logística, tecnología y cuidado de niños.
Sí, gracias, Krishna. Entonces, aquí vamos a hablar de combinación de logística, tecnología y cuidado de niños. De nuevo, ponga sus preguntas en el cuadro que dice Q y A. Ahí puede poner sus preguntas. La pregunta sigue. Yo no tengo la opción de quedarme en casa y tengo que ir a trabajar. Eso es un papá. ¿Estarán las escuelas, bibliotecas y centros de recreación abiertos para que los niños vayan? ¿Está ACPS trabajando con campaña, el YMCA o otros centros de ayuda para expandir los lugares disponibles para cuidado de niños? Así que sí, está ACPS colaborando con este tipo de grupo como el YMCA o centros de recreación.
Sí, esto es una pregunta y una preocupación que muchos de los padres tienen porque obviamente tienen que ir a trabajar, no tienen con quién dejar los niños. En el panel, si nos pudiese ayudar uno de mis colegas para contestar esta pregunta para los padres.
That'll be a good question for Dr. Hart to answer because I know that she's chairing one of our planning teams that is actually working with Campagna and our recreational and parks for the city to have this very discussion. A lot of our families, especially from March to June, had challenges with the child care piece. And there were a lot of lessons learned from March to June. At that time, we were just forced to shut down our schools like overnight. And everything, at that time was closed. This fall is going to be very different because we're now choosing, to have either a virtual or a hybrid approach. It's not mandated by the governor, of the Commonwealth of Virginia. So a lot of our parents, are going to have to go to work. They may not have the option to be at home with their children, and we want to make sure that we are providing support and having some contingency plans or other options for our families who do work. Dr. Hart, if you can kind of elaborate on some of the collaboration we've been having with our external community partners.
Absolutely. So as Dr. Hutchings shared, we have been working collaboratively with a number of our community partners to include RPCA, Campagna, Casa Chiralagua, and other organizations that we are, typically will partner with during the school year, and we are also partnering with them in the discussions regarding before care and after care in a hybrid or in a virtual model. So we understand the importance of the child care conversation. We understand the need to be able to provide options to our families regardless of the model that we select. And so we are working with as many community partners in order to be able to provide some level of service to our families who need that support when we decide which way we're going to go back to our instructional programming.
Muchas gracias, Dr. Hart.
Ok, la siguiente pregunta es, para ambos modelos propuestos, parece que se necesita acceso a Internet y una computadora para participar. ¿Estará ACPS dando dispositivos de Wi-Fi para que pueda conectarse sin tener que ir a algún lugar para conectarse? Para pre-kinder a segundo grado, ¿recibirán Chromebooks para esos estudiantes?
Yo sé que Dr. Hoover habló un poquito de eso, pero si nos pudiese dar más información a Dr. Hoover acerca de esto.
Yes, I may have answered a little bit of this earlier, but we recognize that if it's hybrid or it's fully virtual, all of our students need devices and internet access in order to access the curriculum and their teachers. So we will be distributing devices and internet access in late August, and we will be sharing exactly how that happens once we have it all worked out. When we were at the stay-at-home model in March, April, and May, we were having to mail out devices and mail out MiFis. And now that we are no longer in that phase, now we'll be able to provide families more support in person, and they'll be able to go to a place and pick up what they need. So we're looking forward to that.
Muchas gracias.
La siguiente pregunta es, si las escuelas ofrecen un programa híbrido, ¿tendré que comprar uniformes y materiales escolares? ¿Qué tipo de materiales debo tener?
Nosotros tenemos algunas escuelas que requieren uniformes, pero esta es una pregunta que se la voy a pasar a Dr. Musingo para que nos dé más información y nos aclare esa duda.
Good afternoon again, and that is a very, very good question. In the area of materials and supplies, we at the school level, we purchase our materials and supplies. We have a line item for materials and supplies for our students. We also obviously purchase textbooks and other materials. Our schools actually have a process for uniforms, and that is something that is actually, if we were to go with a in-person model. So that is something that is at the school level, but I definitely will need to follow up on that in terms of the uniforms. But in terms of materials, resources, supplies, as we did with our previous 2.0, 3.0, we have provided students those essential resources.
Gracias, Dr. Musingo.
Y la última pregunta es, ¿quién sería responsable si mi hijo está expuesto a COVID-19 en la escuela y luego yo me enfermo? ¿Se sentirá culpable? ¿Quién ayudará? No tengo seguro de salud. ¿Quién me ayudará?
Esta pregunta tiene diferentes departamentos, ¿verdad? La primera es quién sería responsable si mi hijo está expuesto a COVID en la escuela y luego me enfermo. No sé si Dr. Hutchings o alguien del equipo del panel quiere contestar. Y la otra de no tener seguro de salud, podemos la pasar más tarde.
I think it's difficult to hold somebody responsible for contracting COVID-19. I think that is a very difficult question to answer, because there are so many different ways that people are contracting, the virus. And I think that it is going to be important for our school division, if we have in-person instruction occurring this fall, that we follow all of the CDC guidelines, meaning face coverings are required, hand washing is required, hand sanitizer is required, social distancing is required, so all of our cleanings are required. So all we can guarantee is that we will follow those guidelines. Unfortunately, no organization and no one can guarantee anyone will not contract COVID-19. I wish that we were in a place to do that, but nobody can guarantee that won't happen. So, I think it's a very difficult question to say who's responsible for someone contracting, COVID-19 at this time.
La otra parte de la pregunta era si el niño se enferma y no tiene seguro, ¿quién es responsable?
Yeah. And we have a lot of services out there. I know that Dr. Jackson can elaborate on this, but we do have social services, and we have a health department that can also provide services for any person that does not have insurance. But Dr. Jackson, if you can talk about some of our city programs and services.
Absolutely. We are fortunate, as Mr. Sampson said, to have a full student support team available to our students and families in every school. That includes our school nurse as one of our primary caregivers to our students when they are at school. We have an abundance of resources, and we would bring all of those to bear. We're all having conversations right now. We're in collaboration to ensure, first of all, that we can prevent the spread. That is really our goal with all of the things that Dr. Hutchings has mentioned, the distancing, the wearing of face masks, and the washing of hands, making sure that we can prevent the spread of the virus. And if there is a case, we, again, would work very closely with the health department to get those supports, that medical support that a student might need. If they don't have health insurance, we have partnerships with providers across the city of Alexandria to make sure that our students are supported and that our families are supported. Again, we can't, the communication piece is so critical, because if a child is sick, we are looking at developing checklists for families, things that we can share with you, because we understand that many of us we're lay people, we're not medical professionals. And so what kind of guidance and communication can we give you all as families to help support you not sending a sick child to school? Because that's one of the things that sometimes we know can happen, because families have to go to work. Can we give the child some medication and get them out the door? We understand that. But this is a time where we really need to be responsible, and we all have a part to play in making sure that our kids are safe and that they're as healthy as they can be, given we're in a global pandemic. So there are many supports from this at the school, starting with the school nurse, and then with our mental health professionals, as well as partnerships across the city to support. If a child gets sick, what do we need to do? How do we need to handle that situation so that we can make sure that we have the best outcome for that student, that family, as well as our staff? So I hope that helps to answer that question. But we are providing guidance, looking to develop guidance for families about, before that child even enters the school, what things do we need to be looking for and making sure so that we don't have sick kids and sick staff at school spreading the virus.
Gracias, Dr. Jackson. Otra de las preguntas que recibimos por el Facebook Live es cómo ACPS va a asegurarse que personas que no presentan síntomas, cómo van a prevenir que los otros niños o el personal no se contagien.
So again, one of the things we're looking at as a part of our health and safety committee, and we have a team of experts working on that committee who are well-versed in everything from this virus to other viruses. And they are giving us guidance, guidance based in research, guidance based in the CDC guidelines and other national organizations that are working to stop the spread of this virus. And right now, the critical thing that we know is wearing a face coverings, social distancing, washing our hands, and keeping ourselves away from each other if we know we have some symptoms. But for those who are asymptomatic, again, we are, it's one of those things where we can do all the prevention measures that we have talked about. And once we learn that a student is sick, that's when we can act. But the best we have right now is wearing the face covering, social distancing, washing our hands, and keeping ourselves home or isolated away from others if we do have any symptoms at all.
La otra pregunta que recibimos, las maestros y el personal van a tener que hacerse pruebas de COVID regularmente, y si es así, ¿cuán frecuente y regular?
Right now, the CDC nor the VDOE or the Virginia Department of Education require staff to be tested regularly. Right now, what the CDC is asking is for tests to be conducted if somebody is experiencing symptoms or somebody has been, exposed or part of that contact listing or contact tracing, process to be tested. So if anyone chooses to get tested at this point, it is done through a health professional, which could be set up through their own physician or through some of the local places that are conducting testing services in the area. But there will not be regular testing of staff or students at this time because it is not a recommendation from the CDC.
Y muchas gracias, Dr. Hutchings. La última pregunta que tenemos es de Facebook o de Zoom, que dice, yo trabajo y no puedo ayudar a mi hija con las tareas, no hablo inglés. So, ¿qué recursos hay para esos padres y qué tipo de ayudas se le van a ofrecer? Creo que Dr.
Bethany, you're going to try to talk about some of those English learner services that we offer for families.
Yes, I'm sorry. Could you repeat the question, please?
Esta mamá dice que ella no puede ayudar a su hija con las tareas porque no habla inglés.
Okay.
¿Qué ayudas van a haber para ella si se quedan en virtual, en la casa?
Okay, well, we have, I think the best support that's available right now are our English learner teachers, who are the connection between our students and our families and the school. And each of our English learner teachers has a list, a caseload of students who they reach out to weekly to assist them in their classwork. And as well, any other challenges or support the family may need. So the English learner teacher would be one resource. And then we also have our parent liaisons at each of the schools who are helpful in that area, and that they're bilingual as well. And there's also discussions in our planning teams of having more concrete resources for parents, more instructions and resources available on how to support their children in virtual learning. So that will be forthcoming and will be available in multiple languages.
Muchísimas gracias, Dr. Nickerson.
Gracias.
Ya se nos acabó el tiempo. Le voy a pasar a Adriana. Todas las preguntas que no pudimos contestar, por favor sepan que las vamos a poner en nuestra página. También nos pueden llamar o nos pueden enviar un mensaje, pero voy a dejar para que vaya cerrando Adriana.
Ok. Parece que estamos en la pregunta número 9, ¿verdad, Krishna? Yo creo que es igual a la que ya preguntamos.
Sí, no, ya estamos cerrando porque ya son las 5.
¿Ya?
Sí.
Ok.
So,
entonces ya, yo creo que ya sí, como dijo Krishna, ya eso nos terminó el tiempo, pero no sé si hay algo que el Dr. Hutchings quisiera compartir como para cerrar la sesión.
I will conclude by thanking Krishna and Adriana for facilitating this discussion today, and all of our panelists for your insight and your expertise. You know, all of our families who are logged in or on this Zoom or on our Facebook Live, I just want to thank you all because we really value the input of our parents and our families. You know, you all help us make the experience for our students better, and I hope that you will continue to give us feedback and continue to participate in not just events about reopening, but anything that we are offering within Alexandria City Public Schools. And I also want you to know that this was a wonderful experience being able to have a Zoom that is customized specifically for our Spanish-speaking families. And I hope that we do more of this for our community. Because I'm just honored being able to be on the Zoom. I can't wait until I'm able to speak Spanish so that I won't have to have an interpreter one day. But I am also just thankful that you all are just a part of our team and a part of our ACPS family. So thank you so much for all of your time today, and we wish you well.
Antes de terminar, thank you, Dr. Hutchings. Antes de terminar, me gustaría agradecer a mi co-moderadora, panelista, compañeros y superintendente por escucharnos y por su tiempo. Muchas gracias a nuestras familias. Nosotros estamos aquí por ustedes y estamos aquí para servirles siempre, ya sea enviando sus preguntas o sintonizándonos o llamándonos. Nosotros estamos aquí para ustedes. Si de casualidad no llegamos a contestar sus preguntas, tenga la seguridad que aún serán respondidas. Sabemos que nos enviaron bastantes preguntas. No se preocupen, nosotros estamos aquí, las vamos a contestar y las vamos a poner en el sitio del web de ACPS, en el hogar, la página de reapertura. También lo vamos a poner en Facebook, que sabemos que es bastante popular entre los padres de habla hispana. Y también nos gustaría que se mantuviesen conectados con nosotros a través de el ACPS Express, la página de internet, en este momento tan crítico donde vamos a estar dando bastante información. El plan final se presentará a la Junta Escolar el 7 de agosto y los detalles de lo que eso significa para el personal, los estudiantes y las familias. Lo vamos a compartir con la comunidad antes del 14 de agosto. Gracias por su participación, que tengan una linda tarde y sepan que somos un equipo para lo que necesiten. Aquí estamos. Muchas gracias y que pasen buenas noches.
Gracias.
Gracias. Hasta
Bye-bye.
luego.
Nos vemos.
Gracias.